Is this thing on?
I am Queens.
Hi, everyone. My name is Alyssa, and you are listening to the All Things Pelvic podcast, where you get to follow my life as a pelvic floor physical therapist. That may sound a little boring, but real quick, let me break it down. I bring up topics that most people find difficult to talk about, but maybe it's time we get comfortable with discussing the uncomfortable. I always strive for real talk, good vibes, and mostly all things pelvic. Join me and my guests as we discuss healthcare, culture, and real life topics. Are you ready? Because it's time to take a page out of my playbook. What up, guys? We are back, and today, I know I say today is always extra special, but today is extra special, extra special, because if you listen to my intro, the guy who helped me with my lovely intro is on here today. Cliff, please do, boo.
If you guys can only see how much I'm teasing right now.
He's like straight cheesing right now. I just made him smile so hard.
I think I can go toe for toe with anybody on you being my favorite person and how much it means to me. I'm really grateful for you, but to everybody, what's going on? My name's Cliff. I go by the musician name C Millie. If that is too long for some people, I completely understand. You could just call me C.
C Millie is 3 syllables.
But you know, people be like C Millie. People like Millie. I'm like, no, it's like.
Yeah, but why do they have to spell it out though? That.
You're talking about people who can't like understand the difference between Cliff and Chris. I can't even tell you how many times over the phone I've heard Cliff. No, Chris. Cliff. All right, so.
Oh my God. Well, okay. Yeah. And his music is very dope. His music is dope. And I know we worked hard on my intro and everything, but I personally think that is nothing compared to what you can do. So please go check him out. And we'll go over that, where you can check him out and everything too at the end. But Cliff and I got into a bunch of conversations while we were talking about the intro, especially for this podcast and everything. And he had a lot of questions for me about what I do on my day to day and kind of why I wanted to do the podcast in the first place, what the idea behind my Instagram and all that was. And that's why he's on here today, is so he can ask me those questions. And then another important topic we wanted to bring up is that it is Black Maternal Health Week. And now let me tell you something. First of all, can't keep up with any of these like days, these weeks with like, it's like National Siblings Day or it's now like all of these things. But this is something that is very important, not only this week, but always. So it's a topic that I wanted to discuss for sure. But
absolutely.
Yeah. Cliff, if you had one question for me though, if you had one question for me about what I do on my day-to-day, what would it be? What would it be?
How do you greet people, like to get them to feel your vibe when they, because every time like I listen to the podcast, you guys talk about like some real deep, intense stuff to some people that may be a little on and off, but it's very informative. But the way that you deliver it makes it comforting. So I'm curious to see like how you do that, with your patients, maybe even people like you, maybe you haven't met before and they just set the appointment. Like, how do you bring that vibe in your field of practice?
Okay, wow, you're about to make me like dig deep into my soul, I feel like here. Especially
that's what we're here for.
That's right.
I was saving this for the end, but it fits right now. Yeah. I feel like we didn't tell the people like how we got to the beat.
Yeah.
And I remember the reasoning why we picked this beat when you said, hello, is this thing on? Because the beat itself, shout out my boy Queens Bully. He made the beat. It made you feel like you were in a lobby.
Right.
And when you tap on, like kind of give that mic, hello, is this thing on? Everybody draws their attention to you, kind of. Mm-hmm. And they're sitting, they're comfy, but they're attentive. So like, I kind of want to bring that vibe in this episode because I think all things pelvic really can still house a whole bunch of things because it just depends on the people and the minds that receive it. So yeah, tell them how you do it.
Definitely. So, okay. I kind of have a little bit of a basic answer that I guess leads into more of a deeper one. I listen to my patients. I know that sounds like simple. It sounds simple, right? But I listen and I ask very detailed questions. So a lot of the times I'll just be like, "Oh yeah, like I've had painful sex." And I'm like, well, can you tell me about it? Can you tell me what happened? Was this with a partner? Was it with a stranger? Was it like I kind of like dig deeper into those things, and I do it in a way to make people feel comfortable. And if I do see on my patient's face that they're not comfortable, I'll say, listen, we don't have to necessarily talk about it right now. However, I do have to ask you these questions in order to understand your plan of care a little bit better, of what I'm going to do going forward for you and how to achieve your goals. So usually when somebody hears that, they're like, okay, yeah, I'm going to tell you whatever you need to know, at this point. Usually too, if somebody's coming into a doctor's visit, they're ready for somebody, they're ready to give out details, but unfortunately they're not asked very often. So that's why I make sure to ask those questions. Now, where it does get a little bit deeper for me is that there have been plenty of doctor visits for me where they didn't ask details and they ended up being very important. And I finally had a doctor that I went to who asked me all those questions, spent an hour questioning me about my day-to-day, about my life, that made me question a lot of the things that I even do, where I was just like, Jesus, am I at therapy? Like, where am I right now? Like, am I at my hormone doctor, or am I at a psychotherapist, session? Like, what's going on here? And she just really dug deep to figure out what was going on with me. And this happened to me when I was in PT school. And it's something that I've taken with me to this day, because I was like, I want to treat my patients how this woman treated me. And that's why I dig deep into those questions. So yeah, sometimes I'll nonchalantly talk about my patient who's had painful sex, and I'll talk about it on these podcasts and all these things. But at the end of the day, I really take my time out to listen to them, to see what's going on. Usually with my patients, for the first like 10 to 15 minutes, I'm kind of talking to you about stuff. Unless I already know everything and I'm like, cool, we ready to get started? Did anything change? What's going on with this? Then I'll get started with them. But a lot of the times, like, I want their care to change and I want their goals to be achieved. So I'll ask them those questions. That was a very long-winded answer for what you asked.
No, I love that, because I really do, because that's exactly what I was looking for. Because I feel like like you said, I'm a novice in this space, and I'm very receptive because I want to know more.
Sure.
But I always try to like go back to the basics in everything. So
Always.
in just the medical visits I've had, I know for a fact that when people are a little more warming and comforting, I'm more inclined to reveal more things. But also, just in general, I feel like you guys have to go past a lot of social norms to get the information you need.
Yes.
And a lot of people, some people just don't understand that, or maybe they just don't have that education. But that's why you're there, to get that, because you know how vital it is. And I was curious to see like how you add your personality, because it's a good trait, because you're able to kind of make people feel welcome. Sure. And if you're able to do that, you probably can get way more of the necessary truthful information to kind of get to the right space. So that's dope.
Definitely. And it's funny. So there are two of my patients that I can definitely like pinpoint right now who followed me from my first job into my job now. And now, honestly, especially like after pandemic and stuff, they've become my friends. I definitely consider them my friends. They do as well. And it was funny because I hung out with one of them recently, like for the first time outside of the clinic, and they go, "You're kidding. This is how you are in general." Like, yeah, and they didn't, they kind of like didn't put two and two together. So that's another thing about me too, like, while of course I'm professional at work, but I'm also still myself, my personality is going to come out in that too. And again, that is how I tend to make people feel comfortable. Now, with that being said too, You definitely have to have a certain personality, I think, for pelvic floor work. You do have to know how to ask certain questions. You know, definitely about me that like I don't really have a filter with certain things. You know, like I kind of say what I want. It is something that I am working on in general to like not have as much of a filter. But I can talk about whatever. You know, like I really don't mind talking about many things. And I think that's another thing too, is that again, these people are coming in for very vulnerable. They have very vulnerable symptoms and like very vulnerable things going on. So the fact that somebody's even asking them these questions, like that's enough for them to say, you know, to say like, okay, I now feel comfortable with this person and I'm going to tell her like whatever she wants to hear. Is that always though? No. You know, like I even had somebody last week who was like, I do want to tell you everything. I just can't right now. So I like tried to give them a chance to do that. I said, listen, like I can hang out for a second, you know, and just like I'm willing to just like hear you out and like let you get it out. And they were like, I really can't today. And I said, okay. I said, okay, you know, and like, let's keep moving forward. And it's something that I think she's working on too in order to give me like her full story.
Interesting. So you kind of have to do like, is it like a 2-part appointment at that point?
Yeah.
Like
So,
how many appointments have you had to chain together to get one appointment? I got my
somebody's
roommate.
yelling. I was gonna
I'm
say
in the park.
somebody's yelling in the apartment right now. We on pause. We on pause. All good.
Sorry.
Oh, you're fine.
You're
This
gonna have
is
to
real
edit
life.
that.
This is straight real life right now.
That's fine.
We have a student. We have a student right now, and I joke around with her that I sometimes don't fully evaluate my patient until visit 2 or 3, if that makes sense, because it's kind of like I don't get the full picture sometimes of a person until that 3rd visit, because at that point I now know your personality a little bit more. You know, I know if you're doing your exercises or not. You know, like I get a vibe of the person that I'm kind of dealing with, and
Right.
then I go from there. You know, of like, okay, if this person isn't doing their stuff, what can I do for them to then make it easier during their workday? Like, can they do something during their workday? So I really, okay, to answer your question fully, I try to learn my patients as much as I can. You know, I don't look at it as just this like, okay, I have another patient coming in for this diagnosis. What would I do for this diagnosis? It's more so, what am I going to do for that person to get them better? Because there are 3 people that can come in with the same diagnosis, and I'm going to treat them all differently.
Right. Do you think it's like accepted everywhere as fact that at the fact of you're gonna need more than one appointment to kind of really get to the nitty gritty, or is that more so your style? Like,
Unfortunately, with pelvic floor PT, yes. Regular PT, even orthopedic PT, hospital, whatever it is. We're conservative treatment. You know, PT's conservative, where we're working on getting you stronger. Like muscle takes 4 to 6 weeks in order to see a difference in strength, or we're trying to teach you different movements so that you're pain free. Like that takes practice. I do have though people that come in that are like, please just teach me whatever exercises you can, you know, like I'm okay otherwise, and they want to come in for like a one and done appointment. That is more than fine, but I kid you not, at least 80% of those people end up coming back for more appointments, because after a full evaluation we figure out, actually your core is very weak, or like your glutes are super weak, like your posture isn't the best, like there's something going on. But if a patient ever says that to me, I'm like, cool, I'm going to give you everything that I can within the session. However, I would like to follow up with you, whether that's in 2 weeks or 3 weeks, whatever it is. You know, I could call you too, just for like a quick phone call. You doing okay? Great. If not, I think you should come back in. So yes, most of the time I am seeing patients way more than that one visit. Always. Yeah.
thing. So the bond itself and that like that trust of communication is really the anchor of everything around.
Yeah.
Well, I don't. That's what I'm hearing. It seems
Totally.
like Very heavy.
You hit a certain relationship with your patients and stuff too, where we're sometimes the first people also that do truly listen. Unfortunately, I luckily work with a handful of doctors who listen to their patients, and I'm very, very grateful for them. But a lot of people don't, unfortunately. A lot of people are kind of like, it's a quick 10-minute visit. Oh, your knee hurts. Okay, here's a referral for PT. And then in both of my jobs, we see patients for an hour. I'm with my patients for an hour. It's a long time to be with somebody and not talk about things, like not talk about your life. And that's one thing that I always make sure to do, though, is that like this session's about you. So a lot of my patients, of course, ask me like, "Oh, how is moving?" Or how is this about your life? Like, are you dating right now? A bunch of course they're gonna ask me stuff about my life, but I always make sure that it backtracks to them, no matter what. Too. I always think that that's very important. I can go on a rant about anything, literally anything.
That's a gift. That is a gift.
I don't know if it's a blessing
it.
or a curse. I don't know which one it is, but
That's why I called it a gift, because you can get
thank
a
you.
toy box, so you can get some coal. I'm not saying it's cold, but I'm just saying, like it's the it's broad, the possibility.
That's right. That's right. And yeah, so that, yes, it goes past that one visit. I would definitely say it goes past that one visit, and they're also long visits too. So I definitely try to get to know my patients as much as I can. I am all about habit breaking. That's a big thing that I'm about, because I can give you all the exercises in the world, but if we don't change some of your habits throughout the day and some of your movement patterns, then you're probably not going to get better.
I love how you use therapeutic, because I was actually talking about that earlier this week, and I feel like there's a big difference between therapy and things being therapeutic.
Yeah.
Like, I run, and it's therapeutic for me.
Mm-hmm.
Like, I'm able to see or reveal things about myself just of pure exhaustion, because I don't have anything else in my mind, and it's great. I don't expect everybody to have that. People call it a runner's high, they call it whatever. I just call it therapeutic.
Yeah.
And there's nothing wrong with you adding therapeutic traits or gifts that you have in your practice or whatever that you do. And it's really essential for what you do. So I really do commend you for that, because a lot of people shy away from it because they're like, I'm not trying to be anybody's therapist, but you're not. You're
Right.
just offering something that may be therapeutic to someone, but it's not your control, because you can't tell someone this is therapeutic. It's just being open to it. So I really do like that.
Thanks, man. Yeah,
No
I
problem.
appreciate it.
Of course,
I
of course.
appreciate it. I appreciate it for sure. I think, I mean, clearly I advocate for my patients, right? Like I wouldn't have started the Instagram, I wouldn't have made the podcast if it wasn't for them.
Right.
And as I was one of these patients, also at one point. And so
That post was powerful, by the way.
What'd you say, honey?
I said your post was powerful, by the way, the other day.
Thank you.
I didn't know that about you.
Yeah, and I will unpack that, guys, on an episode as well, but I will go through all my pelvic stuff, that I have been through on my own, and it's something that a lot of people don't realize about me, because I do tend to hide my feelings very well. I put on a happy face usually. I am a positive person. Don't get me wrong, I have my moments, like, where I'm complaining about stuff, but then the next second I'm like, all right, well, what can I do about it, and how can I change it? So, yeah, I will unpack that for sure. But yeah, I was one of these patients as well, so I do understand the vulnerability of it. One of my colleagues actually treated me recently, and she had to do some internal work on me. And, when you're the one on the table, oh, it's a different ballgame. It's a completely different ballgame, where I said to her, I was like, okay, hold on. So it's kind of, I needed a second. I needed a second before it happened. And she's somebody that I trust, like wholeheartedly trust. But when you're on the table, it's tough. And that's where I tell my patients, I'm like, listen, like, only here to help, but internal work is not something that I also force on people either. Is it beneficial? And I get on a soapbox about it if I think it's going to be very beneficial for you. But I also take things out of my toolbox as well. I've had patients that aren't comfortable with me using my fingers, but instead we might use like a dilator. I might have them work on themselves too. If that's what they're comfortable with, that's what we're going to do. So it's like I have to also all therapists also have to think outside of the box as well to make your
That's
patient comfortable.
that's really good because that's a lot of critical thinking for a lot of sensitive offerings. So the fact that you can flex your empathy muscles by putting yourself on the table
Yeah.
from time to time kind of gives you that reminder to not really skip over things. You know, like I know when I used to like work for Apple, sometimes you doing something so repetitively over and over and over and over and over again, you know, you kind of feel like you have a groove. So you know you can work in a certain way, or you can do this, or you can do that. But when you put yourself in someone's shoes, or you have that feeling, it gives you more reason to kind of stick to the right way of doing things. So that's good.
Thanks, man.
Of course. All about gratitude.
Yeah, no, for sure. And I think that definitely leads us into our other topic at hand too, talking about advocating for patients all the time. So, like we mentioned before, it is Black Maternal Health Week now. Heavy topic. Heavy topic, especially after freaking 2020. And I hate to say that too, because, and what okay, I'm gonna bring up BLM for a second. So Black Lives
Talk to
Matter,
me.
right?
Mm-hmm.
Okay. First of all, always the thing.
Right.
I just think that I call 2020 heightened BLM. Like it was heightened because more people were starting to fully understand what it actually meant. You know, I even, unfortunately, this is very unfortunate, but I definitely have had friends who were saying all lives matter a few years ago, and they finally understood why that wasn't okay in 2020, if that makes sense.
Absolutely.
Yeah, and I feel in my head, I'm kind of like, well, it took you long enough, you know, like it took you long enough, but I'm very grateful that people are learning and they're willing to learn different things about the racial disparities that are within our country, our world, our society, our towns, our little, you know, like our little bubbles even too. I just feel like it's very important to understand. So one thing I'll say is like, even though I am a woman of color, I'm still not a Black woman. You know, like I'm not, and I know that there's a difference there. And I've had these conversations with some of my friends, some of my patients that I've talked to, because some of my patients will say, but Alyssa, like you're a woman of color, you get it. And I said, but you know what? Like my parents went through more racial issues than like I have. And don't get me wrong, literally like 3 months ago, this joker was walking down the street, saw me and said, go back to your country. This is in New York City. This happened, right? So it's and that always freaks me out too, because I'm like, I live in New York City. Why is this happening here? You know, that's just weird to me. But racism is a true thing wherever you are. You know, so like yes, that type of stuff happens to me. But like my parents, you know, like my dad was telling me like he didn't get a certain job because of his skin color. You know, like fortunately in our generation, that is breaking, you know, that's breaking a lot more than I think like what our parents had to go through. So what I always say back to my patients or my friends who say that, I'm like, yes, don't get me wrong. Like I wholeheartedly understand that I'm somewhat within the category, but after looking at some of these stats that I have pulled up that we're going to kind of discuss, like Black women and men go through a lot more than these, you know, than other races too. And I know that there's a sticky subject there, because it's like, where do you draw the line? Look at what's been happening to the Asian Americans right now, you know, like in this country with all the hate crimes and stuff too. Like it's weird. It's where do you draw the line? But one thing that I wanted to bring up. Okay. So first things first, there are a lot of pregnancy related deaths, and there are racial and ethnic disparities between those, right? So the most amount of women that this happens to is Black women. The second is women of other racial ethnic populations. So that's just kind of like a generalized category. And then the least amount, but it's kind of wild. Cliff, can you see this? Can you see this picture? Do you see where the least amount is the white women? See, like at the bottom? But there's a big gap in this, guys. It's like, it's a huge gap as to the difference of these. And then...
Guys, I saw it and I don't believe it. I know it's true, but I saw it and I don't.
Oh, yeah. Oh, yeah.
Wow.
So I actually posted something similar today. Now, we'll go over the definition of a pregnancy related death. So, a pregnancy related death is defined as a death of a woman during pregnancy or within 1 year of the end of their pregnancy from a complication. A chain of events is usually initiated by the pregnancy or the aggravation of an unrelated condition by the physiologic effects of pregnancy. So, long story short, pregnancy related death is due to a complication within pregnancy, right? That's kind of what that whole thing was saying. Now, according to the CDC, Black, American Indian, and Alaskan Native women are 2 to 3 times more likely to die from pregnancy related causes than white women, and this disparity increases with age. Another thing, yeah, Cliff's like not okay right
I'm trying to be studious because I want to unpack
now.
what you said about heightened Black Lives Matter, but
Yeah.
it's going to be a little bit. So I want everybody to kind of learn as we're going back and forth before I take it that route.
1000%. So after this, I'm gonna let you go. Okay, I'm
Of
gonna let you
course.
speak.
Nah, nah,
All
do your
right.
thing.
So this last one is cardiomyopathy, thrombotic pulmonary embolism, and hypertensive disorders of pregnancy contributed more to pregnancy-related deaths among Black women than among white women. Now, I definitely have my thoughts on this that I'll unpack, but I want you to talk first, okay? So talk to me about what you thought of, like, even when I just said heightened BLM, and then what you think about those stats that I just read out.
Um, Sorry if it takes me a lot to get through this, guys, but
Yeah.
it triggered me, and it didn't trigger me because I don't trust you. The reason why I'm on this platform and I'm being vulnerable this way is because it's a safe space, and you created this, so you should give yourself a pat on the back. But I know for a fact how traumatic last year was, right? And I'm happy you said heightened Black Lives Matter, because if it's heightened Black Lives Matter and everybody's looking at it in shock, I think two things that are forgotten. Number two on that list is just in general. If it's heightened Black Lives Matter for everyone else, then that means the trauma that Black people have to live with consistently has now been heightened.
Yep.
So now
Yep.
when I go through my regular 9 to 5 and I try to find myself, I try to do all of these things. I told you off this, but I don't mind saying it now. Like, I have to, work on getting some of these deaths out of my mind, because for the entire time that we were quarantined, I'm seeing this over and over and over again, not just on mainstream media, but all over social media and everything. And you want to feel connected, and this is your only way. So you just feel kind of trapped. But I say that's number two because I do agree with like the overall consensus. Like, the one of the bigger issues that's forgotten is the Black woman. And I think that stat that you just gave, people should really, really look at that, because if everybody was heightened with their issues and this was already a statistic, you know, they need to really, 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 really be looked at and checked, and just making sure that that extension out for the mental, because I don't know what's considered a health crisis. Like, I don't have that expertise, but it's alarming.
Yeah.
And
Scary.
when you think about it, and we're both empathetic people, and you take a step back and try to zoom out, there's been a lot of times where I've wanted to just zoom in, because what I'm seeing wholly, it feels a little scary. Like, it feels tough, but no one's like, I'm not saying no one's doing anything, but sometimes it can feel hopeless. So you kind of really, really just have to make sure you just check in with your peoples, and just doing the best that you can, just in general as a person, because everybody has felt something very, very heavy, and a lot of people are having a tough time expressing that. And we really got to be there for each other.
Yeah, and it's interesting for you to say too, like you kind of compared me saying heightened BLM. So the way I thought of heightened BLM too is that I'm now seeing more people kind of come out and say more things. That's how like that's how I reflected on it. Whereas for you, it was a way more traumatic experience. Like we were talking about before we started recording how you like to go out for runs, and look at what happened to Ahmaud Arbery. Like it's like you're kind of having to deal with that now, along with this amidst quarantine too. So there's so many of these changes that are going on. So, and I know this is heavy, hon. I can see it on your face. I see it on your face. I know heavy.
It's like I guess I can say it, you know, and I told you, but I like I said, like I don't mind wearing meat.
Yeah.
It's very tough to get that video out of my head still,
I
you know,
think
and
it's
I'm not
right.
gassing it. It's just
Right.
because I actively do it. You know,
Yeah.
like think about it in its primitive form, right? You go to the movies to watch superheroes, and you watch Superman. And he's doing all this cool stuff, and then all these kids think they're Superman. They want to fly, because it's in their minds, you know, their imagination. But you're feeding the good part of the imagination. If I see somebody that looks exactly like me, doing exactly what I do, and
Mm-hmm.
being in exact spaces, because I did go to Penn State, and there's a lot of places in central Pennsylvania. I'm not trying to call out any spots, but you know, sometimes you have that feeling. I can't imagine, you know, people in those spaces because I left that.
Right.
I can't imagine, like it really is bigger than people understand, and I think the people just really need to listen. Like you do it because you know the purpose behind it, and you're a good person. But I think people really need to just adopt that in general, because
Right.
that's what's needed. People really need to just truly listen. Like how you saw the difference in how you took height in BLM,
Mm-hmm.
and I didn't even notice the difference, because once you said it, I got triggered, and I just was like, yes, it's a safe space. Let me just go all out.
Yeah,
You know.
and say how you feel, and that's how I took it, which is a different, it's a different vibe. So even when you just brought it up before too, I literally said in my head, I was like, oh shit, did I just say something to trigger you more? Did you not like what I said? And that's what I always try to understand too. And
Hmm.
obviously it's not that you felt that way about it. You thought of it different, because for you it was heightened in a very, very traumatic way. Like in a very traumatic way. And I I feel like there was a lot of things kind of happening during that time too, that a lot of people do need to work through on both ends now, on
Hmm.
both ends, because a lot of people, a lot of my friends, who are white and stuff too, they were coming out, they were saying things, they were sharing resources, and I was like, oh hell yeah, I was like, this is great. One of my friends who's African American was like, I don't like it, why didn't you say anything before, kind of, got annoyed about it. So what I said to her, I was like, listen, like I completely understand where you're coming from. I get it. Like now they're saying something and it's because things are heightened. Like there's a lot more posts out there about it. There's a lot of these things happening. Unfortunately, people do post things on social media for attention and not because they actually mean it. However, I was like, people are finally doing something. So we do need to also look at it from that way too.
Hmm.
And then she did kind of talk to one of my other friends about it, and they were fine. Like they talked about it and it was fine. So I think that there was that to kind of work through. Like, is your friend posting it because they care, or are they just posting it to, like, for attention? What is it? Like, what's going on? There are more things that you could be doing. There were campaigns that were out there. There were plenty of, things that I signed, so that it could go through, and stuff too. So like, I think like people were just like in this weird state of learning over and over again too. But I think that it was at least somewhat of a step forward. It's unfortunate that this is all happening, but I think it really has brought to light, like what's happening to a lot of people, to a lot of people.
Absolutely. And you said one thing you do well is listening, but knowing how to listen is also important,
Mm-hmm.
because you just have to be aware of the other person as well, like where they are.
Yeah.
That's what you're also listening for. You're not just listening for the wording. If you know a person, especially like is going through something, and you know who they are, or you know where they're coming from is from a space of emotion, usually you got to be patient.
Yeah.
You know, you can't just tell someone like, don't get mad at this person, because truthfully that they have reasons to be upset.
And every
But
right.
exactly, but just to slowly reel them closer to you in more of like a comfort level, because it's not like I got you so you could be quiet. It's like I got you so we can move forward together. Like
Yeah.
that's important. That's
Yeah.
that's the part of listening, and that's why I can like talk about that, go into that space, because I know when we speak, you're listening to hear me. You're listening and you're being patient. You're reading all of these things. So when I do, fight off those emotions, I can come back and we can get back, because like I understand that I have a purpose bigger than a lot of things that's messed up in this world right now, and I'm trying to find that. And I think the important thing that I guess I want to bring across is, no one is telling you to live in that mental prison, that mental prison of seeing all of those images. And if it's not only Black people, if there's other allies that have those traumatic images and stuff like that, because we all did view it. No one is telling you to live in that mental prison, but I think everyone should be telling each other to come closer and understand, be patient, and try to find some common ground, because it's wild out here.
Yeah, no, 1000%. And then that brings me back to the stats that I mentioned before too, and like trying to understand them. Like, why is that? So when I sent them to you the other day, I tried to kind of think about like, what do I think about this? And why is it? And why is it? Now, unfortunately, today, a patient emails me telling me she had an issue with the doctor because of racial issues. She was like, Alyssa, she was like, I appreciate you referring me to this doctor, but I don't think you should refer any other Black patients to this doctor. And I literally was like, what happened?
Wow.
So I'm not going to like fully unpack that here. Want to keep her privacy at bay. But
Absolutely.
I was like, Jesus, when does it stop? When does it stop? And and I was well aware of this though, beforehand when I referred her to this, to this person and stuff too. And I was like, oh my gosh. So I have a lot of things to say about like why I think those stats are the way they are. Now, you mentioned geography before, right?
Yeah.
I think that plays a huge role into like where somebody grew up and where they're located. Unfortunately, and this is a true stat too. I don't have one right in front of me, but people of color live in more low income places. That just is what it is. Now, there are many white people that also live in these low income places. However, people of color take precedent over that, especially Black people of color take precedent. So you are now living in a low income area, getting less money, most likely too, in general, because of living in a low income area. You're not living in the best area now. And then, unfortunately, and this is where our healthcare system is flawed, if you don't have a lot of money, a lot of the times you're not getting the best healthcare. And that just is what it is for a lot of things. If you don't have good insurance behind you, even if you get insurance through your job, there's usually a deductible of some sort that you need to kind of like hammer through first. And a lot of people aren't willing to pay that. So they either go to the cheapest doctor or they don't go. So that's where even just looking at that type of stuff, kind of going back to basics, like even going back to our initial conversation of going back to basics a little bit, that's kind of what I think about as well. So a lot of these women may not have been fully diagnosed with a heart condition, like might not have known that they had a heart condition. So when they are telling their OB something, or their midwife or their doctor who's about to deliver their baby, they don't even know that they have a heart issue, because it was never diagnosed in the first place. So that's where I think that there's a big discrepancy with that. However, why they also brought up these stats, though, is because there's also a lot of racial issues with practitioners and not fully understanding Black women, and not having their voices amplified enough. And that's where it gets into things that are a little bit more deeper, on a deeper level. Whereas me, like, that goes back to kind of like trying to understand certain things too. I just went to the basics with like thinking about income and all of these things. Now, are there plenty of Black women and Black families that are higher up? Yeah. And hell yeah, like hell yeah, that's amazing. I live for seeing people of color and Black families do their thing, because my family is one of them, where my parents didn't really come from much. So to watch that happen is a beautiful thing. But in most of America, that's not the case. It's not the case.
I'm gonna take a turn at going back to basics to try to pull this together. Is what I'm hearing. I was raised around a lot of women. My mom's the youngest of 12. I was that one baby that they pushed around the stroller in Uniondale, like, this is my little cousin. So I was just always around that love, but I was also around the ugly sides as well. Mm-hmm. And I have a lot of strong mentors whom I call queens. And just in general, when they're in spaces and when they deal with people, you can tell when people start acting a certain way when they're intimidated, and they don't give the same type of services to them. And I've seen that with my own eyes. I don't know how prevalent it is, in the space that we're talking about, but just on a basic level, on a people level, like, I've seen that felt. So I don't know how high that is, but I was wondering if, like, you agree, or is it a little different? Do they give, ways to kind of alleviate that, or is there a space where they can report those kind of things? Because I feel like it is a reality. So if it's a reality, is it accepted as a reality in the common practice?
Okay, and this is something that hits home too, but I unfortunately don't have an answer to that. I don't think there's a place somebody can go to report that, unless it was malpractice of some sort. Unless somebody treated you, gave you the wrong thing. There's really, I don't think so. Now, this is where my lack of knowledge comes in too. Because I fortunately not have had to deal with that, because I am not like that as a practitioner. Yeah. I am not, and I will never be like that as a practitioner.
That's why I praise you all the time, because it's like, I don't know how rare you are, but you are a rarity. Oh, I wish it was.
Don't make me blush. Oh my God.
Hey, I gotta hand out the flowers when I see it, but it's just like, you gotta build that up, because we want more of you. Like, that's why I'm happy you have a platform.
But I'm so happy that you just brought that up, because especially with what this week is, trying to amplify, like, I'm happy to look into that. I'm happy to look into that, and even, kind of rally for a change for that too, for people to report this. So now what one of my patients did was she just called our office, and she just said, listen, like, I would really appreciate if you guys don't refer more people. And she also spoke to me privately as well. Spoke to me privately. And I said, noted, very much so noted. Like, I hear you, and I'm here. I'm here to talk to you about this and stuff too. We are going to talk a little bit more in person, about what happened, and because I want to know details, honestly. I really do. Even though it's going to be hard to hear, I want to know the details. And she actually said thank you for that, though, too. She was like, okay, yeah, like, I'm happy to talk to you about this. And now I'm trying to help her. Like, she now prefers, like, she wants to have a Black practitioner, and not from me, from the one that I was referring her to. And she was like, and I was like, yeah, and I'm happy to help you look. What's unfortunate there is that they're not easy to come by either, so that's another thing. But that's a really good thing to bring up, and I need to look into that. For sure. Now, there are, like, workplaces that have that. Like, you can go to HR and report, report these types of things, but I don't know if there's one in the healthcare field. And, like, if anybody's listening to this and you do know it, like, please reach out to me and, like, let me know. Yeah, That's
Yeah,
where
send me some info too. Like anyone that's like, yo, Cliff, you said something wrong, or yo, Cliff, da 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 da.
yeah,
'Cause
that's the thing too. Like I could be saying something wrong and like somebody's like, no, there's very much so, something. Like and what I do know is I was speaking to one of my employers today and she was like, "How can people do this? Like we took an oath. Like we took an oath to treat all people, to be respectful of all people, any color, any religion, any, anything." And she was like, "It's sad that this is the thing, that this is unfortunately a thing, but
can I go back to basics real quick
always,
on that part?
always,
Because let's go back to geography for that, right?
yeah,
Because depending on where you are, you can be in a very safe, protected bubble, and I call it those two things because I think I'm trying to go from an elevated space of not judging. But I'll share a story. I used to work for J. Crew at one point. I had a lot of professions while I was trying to find my path and my purpose. And I remember one day after, and this has nothing to do with his political motives and stuff like that. It's just him as a person for me as a black man. When Donald Trump was elected,
Jesus,
I was
sorry.
working that day. I mean,
I'm sorry. I'm sorry, guys. That is one thing I will always have no problem saying my opinion and not. I'm so sorry. I did not mean to cut you off like that, but I'm sorry. I hate that man. Okay, like, okay, go ahead.
and it's good, and that's why I love when we chat. I hope we can do this again sometime too, because this has been therapeutic for me.
Good. Good.
But when they were praising him, like basically they were saying like he's gonna clean things up and he's going to I don't remember the exact wording, but it was kind of like bringing structure and order, and I found myself like trembling, like, and I wasn't like angry in the sense of like I wanted to say something, but it was like I'm in your presence as a black man, and I study history just so I can stay safe, stay aware, and stay protected, just in case things repeat itself. And the Central Park Five is something that I knew about before When They See Us, and I had to watch When They See Us. I did watch it once; it was amazing. I do think anyone who doesn't know the story should watch that. But Donald Trump put an ad at that time to advocate for those men dying. And here I'm working in a place where the leader could switch up or could have just done that to someone that looks like me, that again participates in activities that like I do, like being in a park where it's a bunch of rowdy people. You take color aside, it's just rowdy people, and it's proven that they didn't do it. Just being at the wrong place at the wrong time, and to have somebody say they want to take your life like that, you know what I mean? It's crazy, and I'm able to unpack that now, but in that moment in time, like I had to hit an e-brake. I had to tell my manager, yo, can I sit in the back for 15 minutes? Yeah. And a lot of people don't understand, like, that 15 minutes was 8. Well, what was it 8? Thank goodness. It was 4 years. Right. And that's why I wanted to, have people understand that your bubble and your geography is not an excuse anymore. Right. Because our traumas are heightened. And a lot of people are reaching their breaking points. A lot of people already have reached their breaking points. And I thank the universe every day that I'm not one of them. I'm thankful that I can meditate and zoom out and understand that I'm not a prisoner of my emotions. And you're not going to take that power from me. It doesn't matter who you are. It doesn't matter what you control. And it doesn't matter how you're going to do it. I know I've got to be a good person. I know I've got to be better. I just know it. I feel it. And thank goodness I do. Because every day, like, people I'm going too off the wall, but
it's okay.
just that aspect. I just feel like people really need to start paying attention,
Yeah. And I think you just ended that perfectly. Is that people need to pay attention. Like, I actually tweeted something last night. I tweeted, so I was literally like, for anybody that doesn't see that racism is directly in front of your face, I'm genuinely praying for you. Like,
Mm-hmm.
I'm genuinely, like, I actually feel more bad for you than anything, because you're really not paying attention. Like, this is not just bad apples. It's not, like, it's more than that. It's more than that. Do I think people can make mistakes? Of course, make mistakes every day. I make mistakes every day. But a lot of these things that have happened, they're not mistakes. They're not mistakes. They were intentional. And if you don't see it, then I truly think something's wrong. Like, and that is like my true opinion, but I also consider it a fact, honestly. Like, it's one of those things. But I think you just put that perfectly. You kind of just, for somebody else, they may not have felt that way, about voting Trump in and stuff too. And now you went as far as also to, like, you were trembling and stuff. Like, I remember when I found out that he was elected, and I just remember being like, what the fuck? I was like, what the hell? Like, what is this? Like, are you kidding me? And that's how I felt. But, like, it even hit you in a way where you had a physical response. Like, you had a true physical response to that. And I think, again, it goes back to understanding where people are coming from. And that's actually how I would like to end today's episode, because I have there's this woman, and I'm going to shout her out for sure in the description of this podcast. I'm going to tag her in it when I post it. She posted about Black Maternal Health Week, and I think she just put everything perfectly for everybody to understand. So I'm going to read out what she said, okay? So she said, maternal mortality within the U.S. continues to be on the incline with no singular reason behind it. The many factors of why we are losing mothers of color all lie under the basis of lack of understanding and human empathy. With this platform, my goal is to educate and help others to realize what is happening right before our eyes. Statistics are evidence that Black mothers are dying. This list of health conditions is evidence that gatekeepers of our medical care in our communities have the power to change it. This list is filled with conditions that have been studied and researched for many years. Have practitioners taken the time to understand them in relationship to the Black woman? Heavily considering all the risks and listening to the voice of a Black woman about her health. This is something for us to consider, as we all desire our professionals to know a condition in and out, if it were us or our loved ones, right? Yes, healthcare as a whole must change. Yet the landscape of humanity has to first understand and accept that the loss of a life of a Black woman means something. This is a heart posture change. Let us rally behind Black mothers. Share the information you will learn on social media this week. Stand up when you see something wrong. Continue to educate yourself if you are a Black woman and desire to birth children. Continue to educate yourself if you are not a Black woman on health disparities, so that we no longer live in our own bubbles and can help others get the care they need. These things can save lives.
That's a queen that needs to be protected, understood, respected, and praised.
Straight
Because
queen.
Yeah, that's it.
Straight
I'm glad
queen.
you found that.
Yeah, me too. And let me hold on 1 second. I'm gonna see if I can pull it. Just like, and when I read it, I was just like, like, this is what needs to be said.
Mm-hmm.
This is what needs to be said. Her name is Dr. Justine Roper. Dr. Justine Roper. Yeah. And I think she's great. I think she's great. I've actually, like, we've spoken in our messages a few times, and I'm definitely going to tag her in here when we release this episode. And I just think it was kind of like a perfect way to end things. We hit a few points on here that I think are important in general. A few points in general is to fully listen to somebody, even if they have differing opinions. on something. I think that's very important to understand when somebody has a different opinion. Now, Cliff, you and I definitely have matching opinions on all things, but even as we were talking here, there were different topics that we just spoke about that we took them differently because we took them in differently and unpacked them differently because we are different people at the end of the day who vibe, right? We very much so vibe, but we're different people. So I think that's also really important. And I think just continuing to learn, continuing to just learn, listen, educate yourself, please. Please just educate yourself and stop, like, stop trying to sugarcoat the things that are right in front of you.
Absolutely. And this dialogue is so necessary, and I'm grateful to be a part of it. And it shows the beauty in it. Mm-hmm. But I think this is where patience comes in, because it was tough to get through a couple of the topics that we talked about.
Yeah, for sure.
But because I knew you saw me and you listened to me and I trust you, you were patient with me, I was able to get through it. And I think that's what I really, really want to stress with people. You gotta be patient. You gotta be okay with the person not coming to the table, but still sitting down so you can feel it. It's gonna be a little scary by yourself, but I promise you somebody is going to see your effort, and somebody is going to want to inform you on how to sit properly or how to extend your hand to have this dialogue. It's not impossible.
Yeah.
You just got to be patient.
1000%. I agree with you wholeheartedly on that too. Now, some positivity though. Where can people find you, C. Millie?
Oh, wow. Yeah. No, I was chatting. And then they're going to hear some of my songs and be like, whoa, this is not the guy who was talking about all this stuff. Yeah,
Be
you
mine.
can find me.
Shout out. Be mine.
Yeah. You can find me on all social media handles. I am C. Millie. Probably going to be tagged, but I'm on Spotify. I'm on Apple Music, all streaming platforms. And if for some reason you cannot hear a song or it's not playing right, or you want to give me a review, you can definitely slide in the DMs. Even if it's love or constructive criticism, I'm always responsive for feedback, because I just want to evolve as well, with the music. So, yeah, check me out. I got a music video on YouTube. Way more content on the way. Dropping another project this summer. I should be announcing that soon. And yeah, I'm just gonna try to keep these good vibes going through the airwaves.
Yeah, and I just want to thank you for being on here. I know we, unpacked some heavy things today, but it's always a pleasure to talk to you, and I'm really happy you were on here today.
Absolutely. So happy to join the lobby.
Thanks, hon.
Anytime.
Thank you guys so much for listening to the All Things Pelvic Pod. Have questions, concerns, comments? Want to share your story? Remember to follow me on Instagram at @the_pelvic floor playbook. DM me, share my stuff, like it, and let me know what you think. As a reminder, this is not medical advice by any means, so don't be out here doing a bunch of nonsense in these streets. If you need me and want a vibe, you know where to find me. I'm out.